Well, good afternoon. It's the 15th of December, exactly 1 week after my total knee operation, which occurred on December 8th. And I thought I'd revisit the lesson that I'd um, touched on about a week and a half ago. I choose the joy of God instead of pain, and see how that relates to a total knee operation, and it relates how it relates practically in A Course in Miracles. One of the problems that I've always found in the Course in Miracles is, while it's very true, it's a little bit esoteric. So that it talks about the dream, and it talks about detaching yourself from your body, and those are things that certainly can work, and they certainly can work very well in the context of pain. But let me tell you what my experience has been in as it relates to pain in this total knee operation. First, the process. The process was very good. I was very impressed with my surgeons, the surgeon's team. The hospital itself was very clean, orderly. The process they explained very well to me. I was instructed to come in about 9:30 for the operation, which I assume was scheduled about 11. But I had previously been told to show up at 7:30, and so it was a little bit of a delay to start off with. And this was the one thing that I found the whole day of this operation was they were behind a little bit, and there was a good deal of wait time, which kind of is uncomfortable. Maybe not from the standpoint of pain, but uncomfortable in terms of the standpoint of being nervous about things. So I did have to wait quite a bit. I reported to the hospital. They got me right through to the surgical floor, which was the second floor, and I changed my clothes. I put all my clothes in one bag. Any valuables, and the only valuables I had were an insurance card and my driver's license, which I thought I might need to check into the hospital. And those were signed for by security and brought back to me after the operation by security in my room. My clothes were put in a bag. I changed into a regular hospital gown. Luckily, the guy was nice enough about it. He gave me a bag to those gowns. They're always open in the bag. And he gave me a bag to this. I guess because they were operating my knee, they didn't need the bag open that much. So that was, I thought that was made me very comfortable the whole night. I had a few things. They brought me to right there at before they brought me to one of the waiting rooms around the surgical center. A fella came and he shaved my knee and mopped up any hair that might be there, just so to avoid any kind of operative problems, from the hair that I had. And then they put me on a gurney, started an IV with monitoring my blood pressure and heart rate. And I heard that the whole time. And then they brought me to a room which, it's just a room with curtains around it, and it stands at the perimeter of the surgical room. And that's where I kind of stayed for, I think, a number of hours. I was there for a long time, and occasionally somebody would check my heart, something was beating, see if it was still beating, and things like that, but nothing much happened. So I sort of sat around and waited. I didn't, since the curtains were closed, I didn't have any access to see what time it was, so I don't know exactly when I went in, But my wife, they were very nice about texting my wife. The family couldn't wait outside the hospital. They didn't allow any visitors because of COVID. But they texted her that I went into the operating room at 12:53, and I came out about 1:45. So it was about an hour, a little bit less than an hour operation. The first thing I remember afterwards was it was 2:20. Now in that little room, nothing happened. I told you, for a long time. And then all of a sudden, everything happened. The anesthesiologist came in, and he asked to make sure what part that was being operated on. I told him the right knee, and he signed the right knee. And then he explained a little bit about the procedure. Anesthesia, that they were going to give me a spinal, they were going to give me something initially to put me in kind of a twilight feeling, and then give me a spinal. I'd sit up and I'd have a shot in my back, and then I'd go in for the operation, and it would not be a general anesthesia. And so he explained that to me. The surgeon came in, also signed the knee, asked what knee it was, and then signed it. I've got a picture of both of them signing the knee with both of their signatures on it. And then I think he started that twilight in the IV, and that's the last thing I remember. I do not remember anything until I saw I was in that same room, and the curtains were open, and I saw it was about 10 minutes after 2, so I had gone through the operation. I felt I didn't even know anything about the operation. I didn't feel any pain at all in that operation, and I wasn't feeling any pain after the operation. They asked me that question. I couldn't really feel my right leg at all. I couldn't move it at all, but they tried to make sure, can you move this at all? And they explained that they had used a nerve block around the knee to deaden the knee, and the nerve block wouldn't wear off for 12 to 16 hours after the operation. So I felt no pain, bone pain, around that knee at all at any time. So I got back to my waiting room after the operation, and they did a lot of questioning. They explained their particular feeling as far as pain goes. They said, what we're going to do is we're going to give you a couple of narcotics every 4 hours, and if that controls the pain, if you can do it with one pill every 4 hours, that's fine. But if you need more, we'll give you 2 pills. If you need more, we'll keep that up. We want you to keep ahead of the pain. We don't want you to feel any significant pain during this process while you're in the hospital. And I think that philosophy kept me believing in that philosophy even after I left the hospital. Eventually, I went to my own room where they hooked up an ice machine. Now, this is another thing that they used at the hospital that I think was very, very, very effective. Simple machine. It's just a tub. It looks like a vacuum cleaner. It looks like a tub, and it's just a pump, and it pumps water, ice water. You've got to fill with ice, and it pumps ice water in a pad that wraps around your knee. You've got a wrap that wraps around the knee. Simple, very simple, or it doesn't even have an on and off switch. You just plug it in, and it starts pumping. But that ice machine is very, very effective in reducing swelling and the resultant pain. Anyway, from the room I was able to talk to my wife and call her and explain things. And from my own room I was able to talk to the nurse. the problem with narcotics, it does take the pain away, but the narcotics cause you to urinate a lot. So that was the main thing that I felt in the hospital, is I felt urged to urinate, and one of the things they don't want you to do, especially with a knee operation, a hip, or any of those operations, they don't want you to walk unassisted. And there's not a lot of people coming around to help you to get to the bathroom. So they give you a little bottle that they hook onto the railing of your bed in the hospital, and you use that to urinate. And so that was somewhat uncomfortable for me, and embarrassing and stuff. But I mean, it wasn't painful. It was a little bit of discomfort, in the way that she had to do it. And of course, I had a rough time sleeping, because if you feel like going to the bathroom, you wake up every couple hours and then you have to go. And so anyway, but I kind of accepted their philosophy in the hospital to keep ahead of the pain, so that every 4 hours I take one of these narcotic pain pills. There was a number of different pills that they were giving me, and they gave me to take home. Gabapentin is one of them, which does something as far as nerve pain, and also makes you very tired and sleepy. And I take that in the morning and at night, and it's been very effective too. So right now I've kept ahead of the pain, and it's been a week. I've been taking one narcotic every 4 hours, and just today I started kind of stepping down from the narcotics. So I extended it to 6 hours between every narcotic pill, and in the meantime I can take some extra strength Tylenol. Okay, so you could take one extra strength Tylenol maybe at the 4 hour mark, and then take a pain pill at the 6 hour mark. So I've tried that. So far it's been extremely good as far as pain, and I haven't felt a lot of pain. I've been very functional. I've been walking with a walker, but I can walk perfectly fine. The exercise that they gave me are painful, particularly on extension, end range of motion extension, and particularly in flexion, getting your knee all the way back. It's important to do those exercises, and so it's important you do them, either after you've taken the pain medication or in anticipation of taking pain medication, so you'll take a little bit of the pain away. But so far I've been extremely functional. The pain has been minimal as far as I can see, and the result has been excellent. Now, how this relates to the Course in Miracles lesson that I talked about before I went into the total knee operation, I think it's something that we can choose. If we decide to choose joy instead of pain, then maybe we choose the route of pain killing, the route of reducing pain. Intentionally, we make that choice because that's a possibility. And I don't think that's a problem. I think it's a practical application of the Course in Miracles principle. I can choose joy instead of pain. We don't have to choose pain. We don't have to prove anything by proving that our mind can dissipate pain by creating that space between ourselves and our body. Yes, that's probably the most definitive way to reduce pain and eliminate death and things like that. But it's when you're here and you're in the body, and the pain is is forcing you to take note of it, it's better to reduce that pain in whatever way you can, as long as you're not causing problems, as long as it doesn't interfere with your own philosophy. I don't think it does. I don't think the Course in Miracles says that you can't reduce pain by using pain medication. I don't think the Course in Miracles says that you have to rely. It's like the Christian Science people. I don't think you have to rely solely on mental or spiritual methods to heal. I think you've got to take advantage of all the things that are there for healing. And I'll cover that a little bit more in some of my other YouTube videos, which I'm going to cover as far as the COVID and how that's developed and what's going on with the COVID. So anyway, so far this is, I'm signing out right now. Right now, I don't have a lot of pain. It's 1 week after almost exactly a week after my operation, and I'm having a very pain-free experience with my total knee. So